The PAL line started in 2008 with legislature funding to be available to all the primary care providers of the state for consultations about any of the mental health concerns that present to them regardless of insurance. So the PAL program is an elective consult program for all the primary care providers, but we also, as the consultants for the state, do a number of other sorts of consultations, such as mandatory medication reviews. Collectively, altogether, we're doing about 3,000 consults a year at this point. So things have really grown over time, so we're having lots of contacts in the community.
I'm the business operations manager for PAL, and I oversee the daily operations for all the PAL programs, and they're under an umbrella, which means we also serve Alaska, Wyoming. We are also operating on getting more contracts, and especially PAL for schools. And my goal is to use our initial infrastructure to support the program, so we're not reinventing how we're managing the contracts.
We're really inspired by the PAL line and actually by a similar program for moms in Massachusetts that also grew out of their child psychiatry line. It's a provider-to-provider service, and so healthcare providers can call us about any woman who's pregnant or postpartum or actually planning pregnancy where they have questions about mental health care for that woman. We started PAL for Moms because we wanted to make sure that pregnant and postpartum women with mental health problems got the help that they need.
As a navigator for PAL for Moms, my main job is to answer the phones and collect some basic information about providers and get them transferred on to a psychiatrist who can help them with their questions. I also provide resources. If people are looking for something different than what the line is, get them to the right place, and do a lot of background work, just getting things running smoothly and established.
The Psychiatry and Addiction Case Conference, or UW-PAC sessions, is a ECHO model that we use to deliver psychiatric and addiction education to the community throughout the state of Washington. The impact of the program has been pretty remarkable. So we've been doing this for about 3 years so far, and we've been able to reach 24 out of the 39 counties in Washington state. We've been able to provide 5,729 CME hours and reviewed 127 cases over the course of the past 3 years.
I think the PAC program helps address our shortage of psychiatrists in the state in two ways. I think first, we offer a lot of psychiatric consultation out to providers in the community who are not psychiatrists, and we're building capacity for them to care with more complex psychiatric patients. I think the other piece we're doing is we have a lot of psychiatric trainees on our ECHO calls as well. And so they're learning and getting richer and richer training through the PAC consultation and learning to model how to do case consultation out to other providers as well. So we're growing the workforce at the same time we're growing folks outside the specialty. I think psychologists are an incredibly valuable team to our PAC program because we bring expert behavioral expertise in how to do treatments. We also just help think through within care teams, even for folks that are not necessarily behavioral health providers or specialists, how can they weave in different kinds of evidence-informed care that psychologists are expert in. I think we often also add a lot of knowledge base around how to help patients with medications, how to consider medications versus behavioral interventions and balance those kinds of treatment as a team. So we have a lot of fun together.
All of the work that's happening at Evidence-Based Practices for Adults Center is really focused on developing the workforce to be able to provide evidence-based care for individuals with schizophrenia spectrum disorders, as well as that across the illness continuum. And so we have 2 programs as part of our workforce development efforts to disseminate cognitive behavioral therapy for psychosis. So individual practitioners will come to our trainings, and then we can support them as they start to administer CBT for psychosis through these biweekly echo clinics. And then we also provide training and support to folks who are doing team-based care for psychotic spectrum disorders, including our new Journeys teams through our first episode psychosis echo clinic, and then our assertive community treatment echo clinic teams. These echo clinics give me so much energy. They are incredibly reinforcing. To see something click for a learner and to hear about the impact that it makes on a client it's really profound. We have a lot of moments on Echo where people will say, I have to tell you about what's happening with my client, she's doing so well. Or on inpatient, we had a nurse who told us, we had a patient who wouldn't take a shower and came to these groups and is now showering and socializing. So just to be able to hear the impact that this is making, I as a clinician can only see so many patients, but to know that my work is kind of exponentially impacting people around the state is just, it feels amazing.
The Boeing project started because the management at Boeing realized that they were having some problems among their employees with both absenteeism and presenteeism issues, and felt that providing better access to mental health care might help them solve some of those issues. And so in partnership with them, we've developed this call line where a Boeing employee can call in and talk initially to our mental health navigator and then be referred on pretty immediately, if not immediately then within the next 24 hours or so, to talk to a psychiatrist or a psychologist to answer questions about, how do I access mental health care? What kind of mental health care do I need? I'm worried about my kid in college or my kid in high school. What should I do about them? And so we've set up this line so that these potential patients, but employees can call in and talk to a psychiatrist or a psychologist, either on the adult side or the pediatric side.
From our partnership so far with Boeing, we've learned just how fragmented the mental health system is, for example. Even though with employee assistant programs and specific insurance company representatives to help find patients care, it is really difficult to find outpatient psychiatry and outpatient therapy where there's both availability and insurance coverage. This kind of inverted access line with mental health navigation is new. And not only do the patients interact with the mental health navigator when they first call up and then get connected to us if they need to, but that mental health navigator will then follow up with them and make sure that they get care, find them resources, follow up a month later and ask, did you follow up? And if not, why? Did you change your mind, or did the resources I gave you not work out? We'd like to learn more about our system and about more about the community system, and also figure out what the barriers are to patients actually engaging in care once they've taken the first step.
We are proud of our telemental health service here at VA Puget Sound. We believe we are national leaders in the use and innovations that we have developed and implemented. We were one of the first sites to really lead the country in home-based telehealth. Much of the telehealth we now provide goes directly into veterans' homes. We are leaders in the country in terms of implementing the other technologies. Most of telehealth that is done via video teleconferencing. We're actively integrating the other emerging technologies to include phone apps, web-based training, secure messaging as well. So when we think about telehealth, we think beyond just video teleconferencing and think about all the emerging telehealth technologies and how to integrate them into an effective treatment plan. This is an exciting time to be doing telehealth. I think the future is really going to be wonderful. One day I think everyone will be trained up to doing telehealth, and you won't even think about using these technologies. It'll just be part and parcel of what you do.
Telehealth service in VA Puget Sound has been increasing at a very rapid rate. And over the last year, it's increased by about 24% in terms of the number of veterans served. So about 6.5% of the total number of patients getting mental health care in VA Puget Sound had a telemental health encounter within the last year. And this has just been growing incredibly quickly. The most inspiring part of telehealth, I think, is being able to engage in treatment with people who you know otherwise would not have been able to get this care. It's an incredibly meaningful thing to do as a provider, to be able to see people and know that they really appreciate this service that you're providing.